This presentation was designed to provide an overview of Tier 2 and Tier 3 literacy intervention protocols. How do schools support the needs of all students? School teams analyze universal screening data and review the recommended protocols for interventions. Based on the data, they then select the protocols for those needing interventions or develop instructional plans for those needing core support or enrichment. When selecting intervention protocols for students showing foundational skill deficits, schools select ones that best fit the common skill needs of students, are applicable to groups of students, and ones that can be implemented easily and with fidelity. So what do we mean by standard treatment protocol? We mean treatment that has the best chance of working fast for the most common problems. We're also meaning treatment that has been used multiple times with success for many people, and one that is readily available as soon as the problem is identified. The use of standard treatment protocols in multi-tiered models originated from the medical field. Let's think about how doctors use standard treatment protocols in real life. A patient arrives at the doctor's office with the following symptoms: stuffy nose, headache, and a sore throat that has lasted more than 3 weeks. Based on this data, the physician believes that the patient has a sinus infection. So the doctor prescribes a mild antibiotic that is readily available, that has been proven to work fast for multiple patients with these same symptoms. This patient, like most patients with the same symptoms, will quickly respond to the treatment and show signs of improvement. However, some patients will not respond and will need further treatment. Perhaps the doctor will modify the medicine, increase the antibiotic, or do additional tests to determine the next steps for treatment. The doctor will continue to monitor the patient's progress until improvement is made or a clearer diagnosis is determined. Take a moment to discuss with your neighbor other examples of a standard treatment protocol. Maybe you have noticed one that is used often at Chick-fil-A or at the cash register at your local grocery store. Now, discuss with your neighbor why these standard treatment protocols are in place. I'm sure many of you talked about Chick-fil-A and maybe even brought up the fact that most of the attendants at the cash register often respond with the statement, "It's my pleasure." You may have even discussed what you noticed at the grocery store when you're ready to check out your items that you're ready to purchase. When you visit the same grocery store over and over, the cashier usually asks if you have a loyalty card that you can use to reduce the cost of the items you wish to purchase. They may also ask if you have any coupons. These standard treatment protocols are in place to make sure that every customer receives the same experience and that the expectations of the business are being met. Despite the intuitive appeal that one size does not fit all, there are also some educational practices that exist that are broadly effective, can be generalized across contexts and populations, are supported by rigorous evidence, and can be replicated from teacher to teacher to maximize effectiveness and efficiency. And can be replicated from teacher to teacher to maximize effectiveness and efficiency. So you may still ask, why is standard treatment protocols the way to go? Students benefit from consistent, well thought out, well designed, and evidence-based treatment or interventions. Furthermore, following this type of approach improves the efficiency of our time and available resources. It reduces the burden on our staff from having to gather materials, go to specific trainings, or get additional support. It enables quicker access to interventions for students, improves the fidelity of interventions, and benefits most of the students in the intervention group. Let's take a closer look at what educational practices exist that are broadly effective, can be widely generalized across groups of students, are supported by evidence, and can be easily and effectively replicated from teacher to teacher. Over the past school year, each school completed a survey to help our district staff determine what resources or programs were being used across the district to address the needs of students with deficits in each of the skill areas within literacy: phonological and phonemic awareness, phonics, fluency, and comprehension. The list of various resources and programs were reviewed by a literacy protocol committee made up of reading interventionists and district staff. Out of the ones listed, the following resources or reading programs were selected for our district to recommend for supplemental or intensive support in literacy. The ones selected are resources or programs available in many of our schools, can be supported with training to ensure fidelity of implementation, and have been proven to work. Take a moment to read through the list of literacy resources or programs, and be sure to pay attention to those in red font. The red font indicates resources or programs that require prior training before implementation. The person or the department in parentheses indicates who might be responsible or available to provide the training. You will notice that training for some of these resources or programs will be provided either by your PST leadership team, the EC department, or the Title I department. Other programs will require a consultant to be hired at the expense of the school to train the staff. However, there are a few resources or programs that can be implemented after the interventionist has simply read through the teacher's guide or manual and/or watched a recommended webinar. Each of the selected resources or programs were further reviewed by the Intervention Protocol Committee to define what the intervention protocol would look like for students needing supplemental support versus those needing intensive support. To do this, the protocols were designed to define ICE at each level. Instruction. What instruction routines are expected? The scope and sequence of skills, and what training is needed. The curriculum. What materials, resources, or programs should be used. And the environment. How should the intervention be structured, and is adequate instructional time provided for students to be able to respond? This includes how many weeks the intervention will be provided, the minimum and maximum minutes of instruction per day, the minimum and maximum days of instruction per week, and the minimum and maximum students in the intervention group. It also provides suggestions for the recommended instructor for the intervention. The protocol also defines the data evaluation required at each level. At both levels, diagnostic assessments will be recommended to assist teachers in determining where to begin instruction or when students are ready to progress to the next subskill within the program. It also specifies how often progress monitoring should occur and which instruments should be used to progress monitor. Let's take a closer look at a specified program currently used in many of our schools to target students with deficits in phonics. This program is Read Naturally GATE.